The most acceptable and recommended option is to do nothing more, which was answer choice E. The history is consistent with a patient with poorly controlled asthma. So routine chest x-ray, potassium, and CBC are not indicated in this afebrile patient who has no other signs or symptoms of acute or chronic comorbid conditions. Why should we order less? What were the consequences of excess ordering in this case? Well, those who selected a chest x-ray discovered that a chest x-ray showed atelectasis versus pneumonia. So an IV was placed, ampicillin was started, and then the IV infiltrated, causing physical harm to the patient. For those who selected a potassium level, the initial potassium level was elevated, but the sample was hemolyzed. So the potassium level had to be rechecked, causing additional blood draws, which was both a physical harm to the patient as well as a financial blow. And then for those who ordered a CBC, the CBC showed leukocytosis. So a blood culture was ordered. The blood culture, of course, then grew contaminants, and that resulted in unnecessary antibiotic usage. So the next morning, you're reviewing his vitals in the chart. He has a heart rate of 158. A respiratory rate is improved now at 26. He's now off of oxygen, and he's sitting 97% on room air, and he's normotensive with a blood pressure of 88/60. On exam, you notice that his intercostal retractions have resolved. He has improved air entry throughout all lung fields and faint expiratory wheezes. So you decide he's ready for discharge. You've completed your asthma action plan. You arrange for him to be seen in the after hospital asthma clinic so that he can be seen by a pulmonologist within 2 weeks. And you have the asthma educator come to see him and the respiratory therapist review inhaler technique. Did you consider the 5 questions to ask yourself before ordering any of these tests? Let's take a look at those 5 questions that we had talked about in the previous didactic module. Has this test been performed before? How will the result change the care of the patient, if at all? What would be the consequences of a false positive result? Does not performing the test harm the patient? And lastly, am I ordering the test because I feel is needed or to reassure the patient? And also, did you practice high-value cost-conscious care in this exercise? Did you walk through the steps that we discussed previously, these 5 steps, which I'll let you review? So again, as we discussed before, mindful ordering can prevent the unnecessary ordering of tests that are otherwise expensive and can minimize other complications and discomfort to our patients. And we do have guidelines out there to help us minimize unnecessary testing and expense. I'd like to show you again how we can locate the Texas Children's Guidelines. So here we are again at the Texas Children's intranet homepage. So we're going to navigate over to the Resources tab. We're going to click on Topic, Clinical Resources. And then under Clinical Departments, we're going to click on Clinical Guidelines. And then we scroll down and we see here that under our guidelines, we have acute asthma exacerbations. And we can click on the care guidelines, which is a word summary of the recommendations, as you see here. And then we also have available the RAMP algorithm, which is a flow chart that helps guide your management of an acute asthma exacerbation based off of the patient's clinical presentation and their CRS score. And if you see here, these are a few statements pulled from those care guidelines that we just looked at. They suggest that chest radiographs should not be used to determine the level of exacerbation severity. They also state that potassium levels should not be checked routinely in patients with no other underlying conditions that would worsen the effect of hypokalemia. And they say that a CBC is not officially, it's not mentioned in the guidelines, but in general, it does not routinely add to the management of uncomplicated status asthmaticus. So this just goes to show you that the guidelines published by Texas Children's could have helped guide you in your decision-making process about our patient. So let's go on to our next question. You are preparing his discharge bronchodilator prescription, and you select A, Xopenex metered dose inhaler, or an MDI, B, albuterol MDI, C, nebulized Xopenex, and D, nebulized albuterol.